This talk is about the somatosensory system. The talk will be conducted using conversational and question and answer formats. These are the class objectives. You do not need to read them. We will use them to chart our talk. The first question is, which of the following systems does not convey somatosensory information? A. Ventrolateral or anterolateral. B. Lateral cervical. C. Dorsomedial, posterior column or dorsal column. D. Vision. When we think of sensory systems, we first think of vision, hearing, taste, and it is only after that we think of a skin, sensation, joint position, muscle length, and balance. The somatosensory system deals with these less initially thought of sensations. The somatosensory system, in order to manage these sensations, uses a complex array of neuronal pathways, also called systems. Those for the body are called ventrolateral or anterolateral, lateral cervical, or dorsomedial, posterior column or dorsal column systems. Those for the face are called spinal nucleus of the trigeminal nerve system and main nucleus of the trigeminal nerve system. So the answer to this question is D. Next question. Which of the following is not considered a somatosensory modality? A. Joint position. B. Muscle length. C. Crude touch. D. Color. The modality of vision is color: green, blue, red, etc. Somatosensory modalities include dull pain, deep pain, crude touch, and warm and hot, sharp pain, pricking, and cool and cold, touch, pressure, flutter, vibration, and discriminative tactile sensation, joint position, angle and movement, and muscle length, velocity, and tension. So the answer to this question is D. Next question. All somatosensory modalities reaching the somatosensory cortex involve the dash thalamic nucleus. A. Ventral posterolateral or ventroposteromedial. B. Lateral geniculate nucleus. D. Medial geniculate nucleus. D. Interlaminar nuclei. This figure depicts the thalamus. Do not worry about the labels at this point. I have now introduced a coronal cut at the interrupted line, and now a transverse cut through the new interrupted line. As you recall, all sensation except for smell goes through the thalamus to reach the cerebral cortex, so they all have their specific nucleus. Vision involves the lateral geniculate nucleus, from where fibers go to the Brodmann area 17 located at the banks of the calcarean fissure. Hearing involves the medial geniculate nucleus, from where fibers go to Brodmann area 41 or Hertz gyrus at the transverse temporal gyrus. Taste involves the ventral posterior-medial nucleus, from where fibers go to the anterior insula and frontal operculum. Face sensation from the skin, joint, and muscles involve the ventral posteromedial nucleus, the same as taste, from where fibers go to Brodmann area 312. Body sensations, including proprioception and sensation for balance, goes to the ventral posterolateral nucleus, from where fibers go to Brodmann area 312. Dull pain from the skin, joint, and muscles, and probably temperature, involve the interlaminar nuclei, from where fibers go to the insula and rostral cingulate gyrus. So the answer to this question is A. Next question. Precise touch, pressure, flutter, vibration, and discriminative tactile sensation of the body is mediated by dash system. A. Ventrolateral or anterolateral. B. Lateral cervical. C. Dorsomedial, posterior column or dorsal column. D. Spinal nucleus of the trigeminal nerve. The system carrying the different somatosensory modalities can be bundled into three groups based on modality they carry. Group 1, ventrolateral or anterolateral system, and spinal nucleus of the trigeminal nerve system. They are involved with sensation of pain in the skin, joint, and fascia regardless of type. Dull, deep, sharp, and pricking pain are all carried by this system. So is temperature, cold and hot, and crude touch. Group 2, the dorsomedial posterior column or dorsal column system, and main nucleus of the trigeminal nerve system deal with precise touch, pressure, flutter, vibration, and discriminative tactile sensations. Joint position, angle, and movement in muscle length, velocity, and tension. And the last group, group 3, the mysterious lateral cervical system. Little is known about this system in human. It mediates light mechanical stimulation and noxious stimuli. So the answer to this question is C. Next question. During somatosensory testing, we test dash energy. A, phonic, B, chemical, C, kinetic, D, sounds. A receptor is a transducer that converts non-electrical energy into electrical energy, the currency of the nervous system, leading to sensations. Types of energy thus managed include mechanical, heat, kinetic, phonic, and chemical. During somatosensory testing, we usually evaluate receptors that transform mechanical, such as when using a neuropin for pinprick, a cotton tip for soft touch, a turning fork for vibrations, heat or cold when testing temperature, and kinetic when using our fingers for manipulating the patient's limb during position testing. Somatosensory receptors, free nerve endings, are also stimulated by chemical agents such as bradykinin, serotonin, and acids, but we do not test them during neurological examination. So the answer to this question is C. Next question. An important step in the conversion of thermal energy to electrical energy is the generation of a receptor potential. A true, B false. There are 5 requirements for non-electrical energy to become sensation. The first requirement is the presence of an adequate stimulus for a given receptor. This is called receptor specificity. The second requirement is stimulus transduction. Stimulus transduction consists of the conversion of the stimulus energy into the polarization or hyperpolarization potentials, thus creating a local non-propagating neuronal signal called receptor potential. The third requirement is neural encoding. Neural encoding consists of transformation of the energy in the receptor potential to an action potential. This process is labeled first action potential or trigger zone action potential. The fourth requirement is the generation of axon action potential. And the fifth requirement is the generation of repetitive action potentials at subsequently more central or rostral locations, which ultimately leads to sensation once it reaches the appropriate brain area. The term perception is often used to indicate cognition of a sensation. So the answer to this question is A. Next question. After threshold is reached, an increase in amplitude of the input signal increases the dash of action potential. A, frequency, B, number, C, frequency and number, D, none of the above. In this figure, I have represented an axon with the distal region devoid of myelin. This region represents a free nerve ending terminal with 2 characteristics. The first characteristic is that at the tip, it is capable of responding to a stimulus, and the second characteristic is that it is capable of generating a receptor potential. A middle region constituted by myelinated axon, and at the other end, a synaptic button. I will use this model to show you 4 different scenarios. The first one, if an adequate stimulus is introduced, the deformation of the membrane at the receptor level will produce a receptor potential. If the stimulus is not strong enough to reach threshold, as this one is, we will see a subthreshold receptor potential as depicted here in this frame. The specialized zone of the axon capable of triggering the first action potential will not generate an action potential, and as a consequence, at the node of Ranvier's, no action potential will occur, and at the synapse, no neurotransmitter will be released. Now let's look at the second scenario. Here the stimulus intensity is increased. Such an increase will bring the stimulus beyond threshold. Hence, a receptor potential will appear to cross the threshold. At the trigger zone, an action potential will occur as long as the activation of the trigger zone provoked by the stimulus is above threshold, as depicted here. Each yellow bar stands for an action potential. Notice that the trigger zone action potential do not arise from the baseline, but from the tip of the potential generated by the receptor potential. This is so because the membrane in the area that triggers the first action potential behaves in a gradual, step-by-step fashion prior to the generation of the action potential. Another important point to notice is that all action potentials reach the same height. This is so because the amplitude of an action potential reflects the property of the membrane and the ionic concentration of the medium around the membrane, and in this case, they are not modified. At the level of the node of Ranvier, a similar number of action potential will occur, but notice that they arise from the baseline, and they reach the same height as the action potential that occurred at the trigger zone. At the level of the synapse, 3 units of neurotransmitter are discharged. Now let's look at a third scenario. In this scenario, the amplitude of the stimulus is higher. Such a stimulus will produce a receptor potential of high amplitude. The trigger action potential will discharge for the same amount of time since duration was not changed in the stimulus, but it will do so more frequently. Hence, an increase in amplitude of the stimulus increases the frequency of discharge. The action potential produced will be the same, and the synapse will release 5 units of neurotransmitter. The fourth scenario consists of increasing the duration of the stimulus without changing the amplitude. In this case, the receptor potential will be above threshold for a longer amount of time. The trigger action potential will produce more action potentials, but the frequency will not change. The action potentials will reflect the increase in number but not in frequency, and the synaptic discharge will also be increased, so 10 units of neurotransmitter will be released. So the answer to this question is C. Next question. Trigger zone action potential has the same characteristics as subsequent axonal action potentials. A true, B false. This figure represents the end of an axon of a thinly myelinated sensory fiber with an unmyelinated tip. The white rectangle introduced corresponds to a patch of receptor membrane of the free nerve ending. Stimulus in the site will produce deformation of the membrane, leading to opening of channels as represented in this frame, and the production of a receptor potential. This potential is transmitted electrotonically to the trigger zone, where the step-by-step increase of membrane potential once threshold is reached will trigger an action potential. This trigger zone potential will provoke an electrotonic potential that will travel to the first node of Ranvier and generate, by simultaneous altering the membrane potential of the notoranvier and axonal action potential. Hence, trigger zone action potential have graded rise because it is influenced by stimulus and receptor potentials, whereas axonal action potential have a steep rise because all membrane depolarizes simultaneously. So the answer to this question is B. Next question. Which of the following pattern is characteristic of a rapidly adapting mechanoreceptor potentials? A or B? This figure was introduced to you before. If an adequate stimulus is applied, the next step is stimulus transduction. This is followed by neural encoding representing the trigger zone action potential. This produces an axonal action potential, usually referred to as action potential or AP. Slow adapting mechanoreceptors continue producing trigger zone action potentials as long as the stimulus provoked baseline elevation is above threshold, thus leading to axonal action potential throughout most of the duration of the stimulus as long as the stimulus is above threshold. Rapidly adapting mechanoreceptors generate action potentials at the beginning and at the end of the stimulus, because it is only then that trigger action potentials are generated. Thus, axonal action potential will only be present at the onset and at the end of the stimulus. So the answer to this question is B. Next question. Dash are associated with anterolateral system. A. Ruffini corpuscles. B. Annular spiral endings. C. Meissner corpuscle. D. Free nerve endings. Which are the most important cutaneous receptors? I will mention 6 of them. The first one is Pacinian corpuscles. They look like an onion with a stem inside. If cut as shown here, they look like concentric enlarging circles. They are found deep in the dermis. They respond to high frequency vibrations and pressure. They adapt quickly, implying that a stimulus, despite its duration, only produces afferent responses at the onset of the stimulus and at its termination. Pacinian corpuscles have a large receptive field. They send their signal through thick myelinated fibers labeled A beta. The second receptor I would like to mention is Meissner corpuscles. Meissner corpuscles are often referred to as tactile corpuscles due to their high concentration found at the fingertips. They are rather superficial, being found just below the epidermis. They are only present in areas of the body with no hair. They appear as ovoid structures with zigzagging fibers inside, as you can see in this reproduction. Histologically, they look much the same, as previously mentioned, and as you can see in this specimen. They are found just under the epidermis. They are activated by light touch, by changes in position, and by low frequency vibrations. They have a small receptive fields. They are supplied by thick myelinated fibers of the same type as the receptors previously mentioned, A beta. Meissner corpuscles are quickly adaptable. The third type of cutaneous receptor I am going to mention is Merkel disc. They are found in the lower epidermis and upper dermis. They are present in hairy and not hairy skin. Merkel's discs have a small receptive fields. They adapt slowly, thus continue firing as long as the stimulus is present, or at least do so for a long time while being stimulated. Merkel discs are supplied by thick myelinated fibers, that is by A beta fibers. They respond to pressure, position changes, and deep static touch. They are especially suited to determine shapes and edges, and for 2-point discrimination. In this frame, you can see a skin specimen stained with hematoxylin and a special stain for Merkel disc. The arrow points to the Merkel disc in the hematoxylin stain specimen. Now I have added a photograph of Meckel's corpuscle taken with fluorescent light. The Merkel discs are well appreciated. You can also see here the nerve fibers going to it. The fourth skin receptor I like to mention is Ruffini's endings. Ruffini's ending look very different when cut transversally, as indicated by the black line pointed by the arrow, from how they look when they are cut vertically, as you can see in this frame. Ruffini's endings are present rather deeply in the dermis. Adaptation is slow, receptive fields large. They are supplied by large myelinated fibers. Ruffini's endings respond to pressure and are very sensitive to objects' slippage along skin surface. The fifth receptor I would like to mention is free nerve endings. Free nerve endings are found in all layers of the skin, as denoted here, but are more numerous in the epidermis. Free nerve endings consist of modified terminals of unmyelinated axons, that is, of C fibers, and modified endings of thinly myelinated axons. These fibers are called alpha delta fibers. Free nerve endings adaptation is slow. Unmyelinated axons carry dull pain, deep pain, crude touch, and warm and hot. Myelinated axons carry sharp pain, pricking, and cool and cold. The sixth type of receptor I will mention are those consisting of free nerve endings winding around hair follicles. These receptors are supplied by A beta fibers. This receptor responds to light touch and hair bending. Free nerve endings attached to hair follicles are quick to adapt, as indicated in this frame. Free nerve ending winding around hair follicles. Ruffini endings. Meckel disc. Meissner's corpuscles. And Pacinian corpuscle signals travels through the dorsal columns. So the answer is D. It is important to remember that when we say free nerve endings without the attached to hair follicles, we mean just free nerve endings. The next question is, dash monitor muscle changes in length and speed of stretch. Rate of change in muscle length. A. Muscle spindle. B. Golgi tendon organs. C. Pacinian-like corpuscles. B. Ruffini's-like endings. Which are the most important joint and tendon receptors? I will mention 4 types of receptors that are found in joints and tendons. The first one, and most unique joint receptor, is the Golgi tendon organ. Here illustrated. It is an encapsulated structure placed in series with the tendon on one end and the muscle at the other end. You can see this arrangement in this histological specimen. The arrow points to the Golgi tendon organ. Just above, you see several muscle fibers. The nerve fibers carrying information from these organs are classified using a numerical system, unlike those from the skin that are classified using a letter system. They are labeled 1B fibers. The Golgi tendon organ gauges intramuscular tension. The second receptor I would like to mention is Pacinian-like corpuscles, schematically represented here. The signal from the Pacinic corpuscles present in the joint is carried by type 2 fibers. The Pacinian corpuscles are sensitive to pressure. The third receptor found in ligaments and joint is the Ruffinis-like endings. They are present in the joint capsule, where these endings are very numerous. Information from these receptors is also carried by type 2 fibers. The fourth receptor found in the joints are free nerve endings. Free nerve endings perceive pressure and pain. The information is carried to the central nervous system using thinly myelinated and unmyelinated fibers. Thinly myelinated fibers are labeled 3 and unmyelinated fibers 4 by some authors, while others use the letter system alpha, delta, and C to label these fibers. Now we go to muscle, where we should ask ourselves the same question. Which are the most important muscle receptors? Muscle receptors include Golgi tendon organs, innervated by 1B fibers, free nerve ending of thinly myelinated and non-myelinated fibers labeled 3 and 4 respectively, annulospiral endings innervated by the fastest conducting fibers in the nervous system, the 1A fibers, Pacinian corpuscles innervated by type 2 fibers, and flower spray endings innervated by type 2 nerve fibers. Golgi tendon organs, annulospiral endings, and flower spray endings are involved in proprioception. Annulospiral endings and flower spray endings are found in organs called spindles. Spindles are encapsulated organs inside muscles that, in addition to the sensory receptors just mentioned, have small muscle fibers referred to as intrafusal muscle fibers. These fibers are innervated by gamma motor neurons. The spindle gauges length of muscle and speed of a stretch. The spindle is very important for muscle action because, by virtue of their muscle fibers, assure the maintenance of the same level of contraction at different muscle lengths, thus helping to maintain the same force at different muscle lengths. This is an striated muscle specimen. The arrow is pointing to a spindle. As you can see, the spindles are arranged in parallel with the extracapsular striated muscle fibers. So the answer to this question is A. Next question. Dash are not present in humans' peripheral nerves, but present in frogs' peripheral nerves. A. Preganglionic autonomic fibers. B. Postganglionic autonomic fibers. C. Sensory fibers. D. Motor fibers. Human peripheral nerves have different types of functional fibers. Somatosensory fibers from the skin, postganglionic fibers from vessel walls, sensory fibers from joints, sensory fibers from tendons, and sensory and motor fibers from muscles. Hence, peripheral nerve, in order to accommodate these different functions, have myelinated fibers of different thickness and non-myelinated fibers. Myelinated fibers in human peripheral nerve are thickly myelinated, other less myelinated, a third group made of even less myelinated fibers, and a non-myelinated fiber group. Frog peripheral nerves have the same functional type of fibers as human peripheral nerves, but in addition, they have preganglionic autonomic fibers. Hence, in addition to the three types of myelinated fibers present in human peripheral nerve, frogs have a fourth group of even thinner myelinated fibers than the thinnest found in human peripheral nerves. So the answer to this question is A. Next question. The letter classification Erlanger-Kayser is based on time of appearance of compound nerve action potentials following progressive stronger stimulus. A true, B false. The letter classification was the brainchild of these physicians. They were honored with the Nobel Prize for the discovery. You recall we said that human peripheral nerves carry a variety of functional fibers, and therefore human peripheral nerves have axons of variable size, some with myelin, some without it. If we decide to stimulate a nerve, let's say the median nerve at the wrist, and record in the antecubital fossa, we will get a wave called compound nerve action potential. I will now create a chart to explain how the letter classification of axons was created. I will start by placing the functional types of nerve fibers being tested. As indicated here, I have now included the types of fibers present in human peripheral nerves, the cartoonish representation of a nerve recording device, the stimulus to be applied to the skin, and the sensation evoked by the stimulus. When a low intensity stimulus is applied to a peripheral nerve, the patient will barely perceive it. One wave will appear, corresponding to a nerve compound action potential. This is called the A alpha potential and corresponds to the activation of the thickest myelinated fibers, as I have represented here above the A alpha peak. If a stronger stimulus is applied, the patient will feel a tingling sensation. A single elevation with two humps will appear in the recording. The first one is called A alpha, since time-wise it corresponds to the bump we found after the first weaker stimulus was applied, and thus corresponds to the activation of the thickest fibers. The second bump is called A beta and corresponds to the activation of the next group of thinner myelinated fibers, which I am representing here. If we now give a more intense stimulus, the patient will feel pricking pain, and a single wave will appear with three humps. The first two humps corresponds to A alpha and A beta humps we found with a lesser stimulus, corresponding to thicker myelinated fibers. And the third hump corresponds to alpha delta waves, corresponding to activation of the least myelinated fiber present in human peripheral nerves, which I am incorporating here. A person with an inquisitive mind and knowledge of the Greek alphabet would wonder why was the Greek letter gamma, the third letter of the Greek alphabet, omitted, and delta, the fourth letter of the alphabet, used instead. The answer is that the letter gamma was initially used, but later on it was dropped when it was found that the hump labeled alpha gamma was artifactual. Now let's resume the flow of the chart, this time by using an even stronger stimulus, which would be felt by the patient as a pricking pain followed by burning pain. And now a second independent wave will appear. The first wave, the one with the 3 humps, we found with weaker stimuli will maintain the same labels. The second wave is labeled C fibers, corresponding to the activation of the non-myelinated fibers, represented here. Again, an inquisitive mind would ask, why was it not labeled B? The explanation is simple. This classification was first developed using frog sciatic nerve, which, in addition to the functional axon type present in humans, peripheral nerve, as we know from the answer to the previous question, also has preganglionic autonomic fibers, which corresponds to the thinnest myelinated fibers present in frogs. Hence, using a strong stimulus, as depicted here, we would see the same wave as in human initially and an additional wave called B fibers, corresponding to the thinnest myelinated fibers present in the frog. They are the preganglionic autonomic fibers. So the answer to this question is A. Next question. The letter classification Erlangen-Geyser is traditionally used for striated muscle efferent fibers. A true, B false. The letter classification depicted in this frame is based on the appearance of compound nerve action potential after stimulation. Traditionally, this classification is used for afferent axons innervating the skin, joints, and viscera, and also for afferent and efferent autonomic fibers. There is also another classification that uses Greek letters. It is used for striated muscles. The thickest fiber innervating the largest muscle fibers are called alpha motor fibers. The fibers innervating slightly smaller muscle fibers are called beta motor fibers. The fibers innervating intrafusal muscle fibers are labeled gamma motor fibers. So the answer to this question is B. Next question. The Roman number classification is traditionally used for afferent fibers from tendon and muscles. A true, B false. The Roman number classification is based on axonal conduction velocity. In these classifications, the nerves are divided in 4 groups. Conduction velocity in the thickest fibers is between 70 and 120 meters per second. In the next group, 30 to 70 meters per second. The least myelinated fibers conduct at about 5 to 30 meters per second, and the non-myelinated fibers are 0.5 to 2 meters per second. The speed of conduction corresponds to axonal diameter. The fastest have a diameter between 12 and 20 micron. Next one, 6 to 12. The least myelinated, 1 to 6. And non-myelinated, less than 1.5 micra. The thickest fibers are called 1, the next one 2, the next one 3, and the non-myelinated fibers 4. Traditionally, this terminology based on axonal conduction is used for afferent axons in muscles and tendons. Group 1 is further divided into 1A fibers for annular spiral endings and 1B for Golgi tendon organs. Flower spray endings afferent are type 2 fibers. 3 is used for fibers carrying sharp pain, and 4 is used for dull pain. Pain fibers from muscles and tendons are just as frequently labeled using the letter classification alpha, theta, and C fibers respectively. So the answer to this question is true. Next question. Muscle spindle efferents activate neurons in area A, 3A, B, 3B, C, 1, D, 2. The primary somatosensory cortex occupies the posterior central gyrus and the posterior gyrus of the paracentral lobule. The areas occupied by the different body parts are represented in this drawing for men. Notice the position of the foot, the back of the head, and teeth. Similar representation has been done for women. It is called the homunculus. It is very much the same as men. Take a few seconds to locate the anatomical localization for breast and genitalia. Not all authors agree on their location, as you can see in this frame. The primary somatosensory cortex occupies Broman area 312, which I have schematically represented in this frame. The 3A region is activated by afferent from muscle spindles. Cutaneous afferent activate area 3B and 1. Area 2 is activated by joint afferents. Not all books agree with this representation. In the book shown in this frame, the different functions are given and a slightly different localization. As you can see, area 3A is said to receive afferent not only from muscles but from tendons and joints stretch organs. It is also stated that no pain or temperature loss occurs following removal of primary somatosensory area, yet the ability to localize these modalities are decreased. So the answer to this question is A. Next question. Stimulation on one side of the body will activate secondary somatosensory cortex in both hemispheres. A true, B false. The secondary somatosensory area is at the inferior end of the primary somatosensory cortex. Most of it is in the parietal operculum. It has bilateral representation, probably receiving input from the primary somatosensory cortex of both hemispheres. So the answer to this question is true. Next question. Mechanism controlling pain are represented in the dash. A. Spine. B. Periaqueductal gray. C. Periventricular hypothalamus. D. RAF nuclei. E. All of the above. All areas mentioned in this question are involved in pain control. The dorsal horn houses the gate system. Pain fibers in the dorsal horn establish contact with secondary pain neurons whose axons go on to cross to the other side and form the spinothalamic tract, and also they make contact with excitatory interneurons. Inhibitory interneurons produce presynaptic inhibition upon pain fibers, going for secondary pain fibers and excitatory interneurons. Thick myelinated fibers make contact with secondary pain neurons and with inhibitory interneurons. Excitation of the thick myelinated fibers keep the secondary neuron too busy to think about pain, while activation of the inhibitory neurons inhibit secondary pain neurons and excitatory interneurons, thus stopping pain. This explains why rubbing the baby tummy makes pain go away. This is referred to as the gate theory. The other system involves periaqueductal gray, periventricular hypothalamus, and the RAF nuclei. The functioning of this system is not well established, but it appears that the RAF nuclei excites inhibitory interneurons in the dorsal horn. This system works in time of high stress. So the answer to this question is E. Next question. Referred pain is explained by cutaneous pain fibers sharing a dorsal horn neuron with pain fibers from an internal organ. A true, B false. This figure shows a sensory second neuron receiving pain input from visceral and somatic sources. This situation is relatively common. Hence, pain at certain cutaneous location may indicate a specific visceral malfunctioning. In this drawing, you can see the skin sites where pain from different organs prevail. An example is the anterior left chest and medial surface of the left arm hurting during a heart attack. Take a few seconds to notice the skin areas and corresponding internal organs. So the answer to this question is A. Next question. The primary afferent fibers whose receptive field center is closest to the point of stimulation will produce more action potentials than those on the periphery. A true, B false. The receptive field of a nerve is the area it innervates. In the case of the skin, the surface area it innervates. But not all regions within a receptive area have the same density of nerve terminals. Those at the center of the receptive field have more fibers than those in the periphery. The peripheral field of one neuron overlaps with the peripheral field of other neurons, as depicted in this frame. I am now going to label each neuron in this figure: the green neuron, the yellow neuron, and the purple neuron. The structure I have added corresponds to a blunt object that is pressing right on the receptive field of the green neuron and less so on the receptive fields of the yellow and purple neurons. As a consequence, the green neuron discharges very frequently and less so the yellow and the purple neurons. In this frame, I have represented the neurons and their discharging patterns. I have done so to explain the process of lateral inhibition. Here, I have represented the yellow neuron with 3 axon terminals. I will now remove this one because it is not important for our explanation. I have now added a second neuron in line with the first one. And as you can see, the side axon is now connecting with an inhibitory neuron. Now I want to call your attention to the purple neuron, which has the same connections as the yellow neuron. I have now introduced the green neuron, which is receiving inhibitory signal from the 2 inhibitory neurons. That is the 2 pink neurons. I have now introduced a second green neuron in line with the first green neuron. The first green neuron provides excitatory stimulus to the second green neuron. The first green neuron also connects with 2 inhibitory neurons, represented in red, with one of these neurons' axon going to the yellow neuron and the axon of the other going to the purple neuron. Hence, the yellow neuron output, due to inhibition by the red neuron, will reduce the output of the second neuron to 0. The output of the purple neuron is also reduced by the same mechanism to 0. The discharges from the green neuron will also be reduced by the same number of potentials, but it will still produce excitation. It starts with 15 potentials and ends with 7, but the yellow neuron and purple neuron that started with 4 potentials each are now silent. This process is called lateral inhibition. So the answer to this question is true. Next question. Position sense from the right leg is carried by A. Left posterior column, B. Right spinothalamic tract, C. Left spinothalamic tract, D. Right posterior column. The spine, here represented in a specimen and now illustrated to show its variations at different spinal levels. In this frame, I have selected one segment, C8, to provide an overview of the structures and pathway tested during sensory examination. Unlike in the nerve, where the different sensory modalities are intermingled, in the spine, the modalities are anatomically separated. At this level, we can see the dorsal compartment, called the posterior funiculus, the lateral funiculus, and anterior funiculus, separated by the angular yellow line in this frame. The posterior funiculus is occupied by the fasciculus gracilis. The fasciculus gracilis bring lower body fibers from the ipsilateral dorsal spinal ganglion sensory cells, mainly from the ipsilateral leg. And we can also find in the posterior funiculus the cuneatus fascicles, bringing upper body fibers from the ipsilateral dorsal spinal ganglion sensory cell, mainly from the arm. These fasciculi carry position sense and motion sense, vibrations, and soft touch, especially discriminative soft touch. The axons in these columns end at the gracilis and cuneatus nuclei found in the lower medulla. The neurons in these nuclei are the second neurons of the sensory unit involved in the transmission of position sense, motor sense, vibration, and discriminative soft touch. This system is called the dorsolateral pathway or the dorsolateral lemniscus system. The two other modalities carried by this system are graphesthesia, the ability to recognize a letter drawn or a number written in the skin, and stereognosis, the ability to recognize objects by touch. Now I am going to talk to you about another system called the spinothalamic system. The anterior part of the lateral funiculus carries conscious sensation, here represented in green. The modalities carried here are soft touch sense, especially non-discriminative, cold sense, warm sense, and pinprick. In the anterior funiculus, we find fibers that carry soft touch sense, mainly of the non-discriminative type. The fibers in the lateral funiculus and in the anterior funiculus correspond to the contralateral part of the body and are axons of neurons found in dorsal horn in the opposite side of the cord. These neurons are the second neurons of the spinothalamic tracts. So the answer to this question is D. Next question. All sensory information carried by anterior lateral system spinothalamic tract goes through the ventral posterolateral nucleus of the thalamus. A true, B false. The spinothalamic system can be divided in three tracts. The archispinothalamic tract seems to be evolutionarily the oldest. The archispinothalamic fibers traveling in the spinothalamic tract reach and make contact with the brainstem reticular formation and the periaqueductal region. Rostral connections are uncertain. The second tract is the paleospinothalamic tract. Fibers in this tract travel in the anterolateral funiculus to the interlaminar thalamic nucleus and from there to the insula and the rostral cingulate gyrus. The third tract is the neospinal thalamic tract. The neospinal thalamic tract fibers traveling in the spinal thalamic tract go to the ventroposterolateral nucleus of the thalamus, and from there to the primary somatosensory cortex at the postcentral gyrus in the lateral surface of the cerebral hemisphere, and to the posterior gyrus of the paracentral lobuli. So the answer to this question is B. Next question. T dash cross the midline most rostral. A. Dorsal horn rostral axons. B. Internal arcuate fibers. C. Spinal nucleus of the trigeminal fibers. D. Sheath or main nucleus of the trigeminal fibers. Dorsal horn rostral axons carry crude touch, pinprick, cold and hot fibers. They cross at the level of the spinal going through the anterior white commissure. Axons of neurons carrying position and motion sense, vibration sense, and light or soft touch, especially discriminative soft touch submodalities, as well as stereognosis and graphesthesia. Cross to the opposite side at different sites than those for the anterior lateral system. These modalities in the spine travel in the dorsal column, in the fasciculus cuneatus. Those for the arm are indicated here. Upon reaching the lower medulla, the axons of the dorsal ganglion neurons carrying these modalities end at the cuneatus nucleus, where the second neuron of the dorsal system, also called the dorsal column medial lemniscus, lives. The axons from these second neurons send fibers to the opposite side of the medulla, forming the internal arcuate fascicle, which after crossing the midline go up as the medial lemniscus. The fibers of the medial lemniscus ascend through the upper medulla, pons, and midbrain, going towards the thalamus. We have just explained the dorsal lateral pathway for the upper body, shown here. Now we will talk about the fibers carrying same modalities from the lower body. These fibers follow a similar trajectory. The only difference is that they travel in the gracilis fascicle and they make contact with neurons in the gracilis nucleus. The pathway of the upper and lower body for these modalities of sensation is called, as we have previously mentioned, the dorsal column medial lemniscus pathway. What about protopathic sensation from the face? The equivalent to the dorsal horn sensory neurons for the face is the spinal nucleus of the trigeminal nerve. This nucleus incorporates protopathic sensation information from the trigeminal nerve, facial nerve, glossopharyngeal nerve, and vagus nerve. This is a view of the brainstem. The trigeminal nerve is clearly seen on the right, but remember that in addition to 5, 7, 9, and 10 also send fibers to the spinal nucleus of the trigeminal nerve. I have now shaded the position of the spinal nucleus of the trigeminal nerve and the most dorsal region of the spinal dorsal horn. These structures are adjoining. Neurons serving facial sensation are found as low as C2 or even C4. I have now added the formation and course of the trigeminal thalamic tract. This tract ends at the ventral posterior-medial thalamic nucleus, and from there fibers go to the mid-region of the postcentral gyrus where the face is represented. What about epicritic sensation of the face? The equivalent to the nucleus gracilis and cuneatus for the face is the principal main or chief nucleus of the trigeminal nerve. This nucleus appears to receive information only from the trigeminal nerve. The principal nucleus of the trigeminal nerve is in the upper half of the pons. It sends rostral fibers that constitute the dorsal trigeminal thalamic tract. These fibers are going ipsilateral, and contralateral fibers that join the trigeminal thalamic fiber from the contralateral spinal nerve nucleus to become part of the ventral trigeminal thalamic tract. The fibers in these tracts advance rostrally and end up at the ventral posteromedial thalamic nucleus. Neurons from this nucleus advance rostrally and end up at the mid region of the postcentral gyrus where the face is represented. This image depicts the relation between the decussation of the spinal and principal trigeminal fibers. So the answer to this question is D. Next question. The lateral cervical system uses dash neurons to reach the thalamus. A2, B3, C4, D5. This textbook mentions the lateral cervical system as one of the ascending spinal tract carrying somatosensory sensations. This tract mediates light mechanical stimulation and noxious stimuli. The first neuron is in the dorsal ganglia, represented in green. The second neuron is in lamina 4 of the dorsal horn throughout the length of the spinal cord, represented in aqua. The third neuron is at the lateral aspect of the dorsal horn, inching into the lateral funiculus. The fourth neuron is in the thalamus, and the fifth neuron at the cortex in the postcentral gyrus. Fibers from the second neuron to the third neuron travel in the lateral funiculus in the dorsal region. Fibers from the third neuron in the lateral cervical nucleus cross the midline at the anterior cervical commissure and join the medial lemniscus, traveling to the thalamus. So the answer to this question is B. Thank you very much for your attention.